This conference will now be recorded.
Ethan, all yours.
Thank you. On behalf of the Department of Consumer and Business Services, Division of Financial Regulation, my name is Ethan Baldwin, and I welcome you to this public hearing to discuss the Division's preliminary rate decisions for 2022 health benefit plans. The Division holds hearings on all individual and small group rate filings. Each hearing is generally limited to discussion of the Division's preliminary decision and final objections regarding the filing. During this time, carriers will be permitted to defend their assumptions using information submitted in the filing or indicate agreement with the findings. Carriers may not introduce new information or propose new or revised assumptions at this time. When reviewing a rate request, Division actuaries consider such factors as recent and projected medical care and prescription drug costs, including any benefit changes, past and future loss ratios, that is, how much of every premium dollar goes to pay healthcare claims costs. This is to ensure the requested rate is not projected to trigger federal rebates or payments from other federal programs. Actuaries also review the recent history of rate changes and the overall financial strength, including profitability, investment income, and surplus of the company, as well as administrative costs. Division staff also ensure that the filings meet all requirements of the Affordable Care Act and determine whether or not the anticipated number of enrollees will adversely affect an insurer's financial position. You can review full rate requests for all companies on our website, www.oregonhealthrates.org. All communication for every health insurance rate change filing, including written answers to all questions asked during the review period, are there as well. In this hearing, we are discussing in this order the preliminary rate decisions that the Division has made on small group health benefit plans filed by HealthNet Health Plan of Oregon, Inc., UnitedHealthcare Insurance Company, UnitedHealthcare of Oregon, Inc., and Cigna Health and Life Insurance Company. Our agenda will be representatives from each company will make a presentation and describe their request. Then Division staff will lead a discussion about the Division's preliminary decision on each filing. Then we will take public testimony. If you'd like to make a comment on a company's filing, please unmute, introduce yourself, and make your comment. Comments will be accepted online through 11:59 p.m. on July 7th. The Division will make a final decision about these filings shortly after the public comment period ends today, July 7th. HealthNet, please begin by introducing yourself and explaining your rate request.
Good morning. I'm Doug Hale, the Director of Actuarial Services in representation of HealthNet Health Plan of Oregon. I'm also joined by Brian Curley, our Vice President of Small Group Pricing, and by Dylan McKenzie, our Senior Actuarial Analyst. I'm here to discuss our preliminary rate filing scheduled to first impact the first quarter of 2022. Our requested rate impact is an average annual increase of 4.4%, which consists of a minimum rate increase of 1.4% and a maximum rate increase of 9.7%, which is dependent on the plan and region. This rate adjustment affects about 3,416 members counted as of February 2021. Also included in this filing is the discontinuation of our Community Care 3T product. This product is being discontinued in the small group market because of proposed changes initially only intended to affect the Community Care 3T network and would have resulted in pricing and benefits that were inconsistent with our market strategy. This product discontinuation affects 7 plans and about 522 members, also counted as of February 2021. For the purposes of this filing, we crosswalked the impacted membership to the closest PPO product equivalent. At the time of our initial and revised rate filing, no other network changes were identified. But consumers may provide feedback on our network through our customer service phone number found on our website. Minimal plan changes were made for 2022. We are not adding any new plans, and no benefits were removed for 2022. We made slight adjustments to the out-of-network, out-of-pocket maximum on PPO products, which are now tying to the in-network level benefit rather than being a fixed amount. Otherwise, no major adjustments were made to our in-network benefits. After our initial filing, we did make minimal adjustments to reflect the $75 cap placed on insulin out-of-pocket costs in accordance with HB 2623 and the prescribed changes to the Oregon standard plans. Prescription drugs made up 19.6% of our allowed claims during the 2020 base period, and we are using an 8% annualized prescription drug cost trend. And we expect the prescription drugs to contribute to 20.5% of our 2022 allowed claims. At the time of this filing, no significant formulary changes were anticipated for the 2022 benefit year. This concludes our presentation of our 2022 Q1 small group market rate filing, and thank you for your time.
Thank you. Division staff will now lead a discussion about the division's review of the filing and preliminary decision.
Thanks, Ethan. Good morning, everyone. My name is Ying Liu. I'm an actuary of the division and the primary review of this filing. The company originally requested a 4.4% average annual rate increase from the first quarter of 2021. The minimum rate change is 1.4% increase, and the maximum is 8.9, as mentioned by the company. After the original filing was submitted in responding to the House Bill 2623, the company estimated about 12 cents PMPM impact to the overall rate level. This is very small change with a small magnitude of the impact. The company's annual rate change remains 4.4% increase on average. This insulin bill impacts each plan differently, and the mostly affected plans are the bronze plans. For example, there is a $2.75 PMPM rate impact to the standard bronze plan, and with that, the maximum rate change increased from original 8.9% to 9.7% after the House Bill 2623 modification. So with that, the division's preliminary decision is approved as modified based on our review. So we normally start our review with the data with the 2020 experience, and during the experience period time, the company had about 2,900 members, and the total premium was around $16.9 million. The medical loss ratio was 89.3% before applying risk adjustment. The risk adjustment was based on the consulting firm weekly estimate, which is higher than the market average, with the estimated receivable of $31 PMPM. Adjustment to the experience period also including the adjustment to the COVID, which is very unique to this year's filing. The adjustments including removing the telemedicine claims and COVID-related testing and treatment. With that, the company also added $5.30 PMPM to account for the abnormal utilization pattern due to the COVID, which the patient is normally delay or decrease the visit to the doctor office or the hospital, and which we call the COVID rebound adjustment. This is consistent with the market-wide practice we saw across the filings. Projecting into 2022 rates, there are key items. There are few key items that's just in the filing. The first one is the trend. The company projects 6.5% pricing trend and vary by medical and pharmacy. Those are consistent with the market-wide projection. The calculation also accounted for demographic, geographic, plan mix shift, cost sharing design, as well as the network adjustment. For the risk adjustment, the company projected similar relativity as the experience period. The projected risk adjustment is a receivable of $27 PMPM. As mentioned, the COVID-related claims like telemedicine and testing treatment were removed from the experience period. So to account for the COVID vaccine costs and continued treatment, the estimated cost was loaded back. So at the end, the removed claims and the loaded part were pretty much a wash. So we are okay with that. The 2022 Q1 target profit is 1.6%. The company's long-term goal is 3% and expect the COVID situation going to phase out. It's going to reestablish the 3% profit goal after the situation normalizes in the future. And we consider the company's position to evaluate the COVID impact and the profit margin on a combined base is appropriate. At the end, the company also include administrative costs, which include expenses, taxes, and fees. As a result, the projected medical loss ratio is 84.5% based on the federal calculation. And the required rate change from the first quarter of 2021 is 4.4%. As mentioned earlier, there is a very small modification of 12 cents PMPM based on the House Bill 2623. So we have no problem with that. That's all the calculation and things we all look through and we are okay with that. So we consider the above assumptions reasonable and are supported. The division agreed on the company's methodology and the calculation for the original filing and the modification. And the division's preliminary decision is approved as filed. And at the end, I want to add that CMS has recently released the final risk adjustment result. So has the company had a chance to take a look and reevaluate the estimate?
We are continuing to review the final results and distribution of the risk adjustment transfer program and are finalizing any adjustments to our rates at the moment.
Okay, so yeah, so after finalized, so if any major deviation from the preliminary, so yeah, please communicate with us through SERV and we can incorporate those in the final decision. So I think that's all from me. So I will hand off back to Ethan.
Thank you. HealthNet, do you have any additional information or comments you'd like to make at this time?
Not at this time. Thank you.
Thank you. We will now take any public testimony. Please unmute and introduce yourself. All right, sounds like no one has signed up to testify, so let me remind anyone listening that today, July 7th, is the last day for public comments. They can be submitted through our website, www.oregonhealthrates.org. Next, we will hear from UnitedHealthcare Insurance Company. We will pause briefly. United, please
Sorry.
begin.
Sorry. I was going to say, Shamshir, are you presenting? I was talking on mute.
Yes, I will be presenting.
All right. I am making you the presenter right now, and I will step out of the way. Ethan, you're on.
Great, thank you. United, please begin by introducing yourself and explaining your rate request.
All right, give me 1 second if I have the. So can you all see my screen?
Yes.
Okay, wonderful. First of all, thank you very much for giving us the opportunity to present to you the summary of our product offering for small group market effective 1/1/22. We will also share our proposed rate changes effective 1/1/22. My name is Shamshir Plaha, and I am the pricing director with UHC. I have with me Mr. Tim Cussy. He is the sales VP for Pacific Northwest for UHC. Tim will discuss the product changes we are bringing to the market, and then I will discuss the proposed rate changes for 1/1/22. So with that, I will hand it over to Tim. And Tim, you can take it from there and let me know if you want me to move the slide. Let me move it to the next slide.
Very good. Thank you, Shamshir. For 2022, our product portfolio contains 52 plans. 19 plans are renewing from 2021 without change. We have 18 plans that are receiving new plan identification codes as we move to a new pharmacy formulary. We have 15 new plans that are being introduced, which is part of a new network that we're providing in the market. And we do have 7 plans that we're retiring from 2021 to help limit the product portfolio size. This will impact only 4% of our members, and these members will be mapped to comparable plans. There will be minor benefit changes, mostly relative to member cost shares to help manage utilization and keep premiums low. And we'll also be introducing a designated diagnostic provider program to help encourage members to use the more efficient and high quality, low cost labs and imaging services. And by using these providers, we can offer lower member cost shares. We're also we currently offer 2 different types of pharmacy formularies. And for 2022, we'll be migrating to a single formulary for all customers. Prescription drug costs are about 15% of the total cost, and we found the migration to a single formulary will help reduce those costs. And for 2022, we'll be adding an additional network, as I mentioned. Currently, we have 1 full network and choice and 2 narrow networks. And with the introduction of a 4th network in 4 counties, Lane, Multnomah, Washington, and Clackamas, we're looking to provide members with lower cost and higher quality providers. And with that, Shamshir, I'll return it to you.
All right, thank you very much, Tim. So for the next part, let me share with you the summary of the proposed rate changes that we are asking effective 1/1/22. So starting with the legal name of the company is UnitedHealthcare Insurance Company. The average rate change that we are proposing is 3.5%. So that is 4 quarters of 22 over 4 quarters of 21. The range of the annual rate changes is minus 7.6% to 8.1%. And the 3.5% average rate change also includes the benefit change, which is just the plan mapping, and minor benefit changes that Tim mentioned before is about negative 1.2%. Since this is small group rate filing, so effective 1/1/22, we will be increasing our premium by about 1.9% on a quarterly basis, and that accounts to about 7.7% annual premium trend. This filing affects 10,374 members as of March 2021. And the total number of plans that we will be offering for 1/1/22 are 52. 33 plans are the new plans and 19 plans are continuing from 2021. The following factors, the rating factors, will be changing since our last filing that was effective Q2 of 2021, and those factors are base rate, the area factors, as well as the plan factors or plan relativities. The next slide discusses about the changes that we requested already, and then one change that we will be requesting to make since the filing was submitted. The first change is the Covert Adjustment. So the Covert Adjustment factor that was changed from 1.06 to 1.042 by considering a more robust approach for calculating the factor. The other change that we will be making is for our designated diagnostic provider lab program. And here we will be encouraging members to use, as Tim mentioned, the more efficient providers, but members can also get services when they use non-designated providers. So we will be moving the benefits to a tiered benefit. And due to this change, there are other changes that happen or that will happen in the rate filing. The first one is the AV, the actuarial values of all the impacted plans will change, and that is what we will follow with our reviewer. And secondly, due to the AV changes, one plan fell out of AV compliance range, and for that we will be changing the benefit for that plan. What we are proposing is to change the out-of-pocket max for that plan to bring that plan back to AV compliance. The third change that we will be proposing is the CMS risk adjustment report that was released at the end of last month, and we are still calculating the impact, and once we have the number, we will certainly ask our reviewer to allow us to change the rates if needed. With that, it completes the summary of the proposed rate changes for UnitedHealthcare Insurance Company for small group market effective 1/1/22. Ethan.
Thank you. Division staff will now lead a discussion about the review of the filing and preliminary decision.
Thanks, Ethan. Good morning, everyone. My name is Ying Liu, and I'm an actuary of the division and the primary review of this filing.
My name is Michael Sink. I'm Senior Life and Health Actuary for the division. I am the secondary reviewer for the filing.
Hi, and my name is Tasha Sizemore. I'm the Life and Health Program Manager for the division.
Okay, let's move on the review of this filing. And for the 2022 first quarter, the company originally filed 5.2% annual rate increase. The minimum rate change original filed was 6% decrease, and the maximum rate change is 9.9%. And due to the company's credit weighting change, like mentioned in Shamshir's presentation, the company modified the COVID utilization rebound from 6% to 4.2%. The COVID rebound is adjustment unique this year to account for the abnormal utilization due to people delay or decrease the office and hospital visit. As a result, the modified annual rate change is 3.5%, and this is 1.7% rate decrease from the original filed. With that, the division had discussions and considered, since the company's rate is at the high end, and the 1.7 decrease is very unlikely to disrupt the market, and it's more likely to benefit the consumers. With that, the division's preliminary decision is approved as modified. The rate change was developed based on the 2020 experience, and during the experience period, the company had about 12,500 members with $71 million premium. The medical loss ratio was 76.1% before applying risk adjustment. The company anticipated slightly lower than market average risk score in 2020 and estimate 0.2% risk adjustment payment to the pool. After adjusted for the estimated risk adjustment, the medical loss ratio is about 76.5% for 2020. And since this minimum loss ratio rebate based on 3-year rolling average, so one single year's loss ratio is not expected to trigger a rebate for the calendar year of 2020. Projecting into 2022, there are following items that addressed in the filing or noted by the division. That the first one is continued decrease in membership. The project membership in 2022 is about 10,400, and the company membership has been decreased in the recent years. The company projected 0% risk adjustment payment for the rating period based on the preliminary risk adjustment result. And as mentioned in the company's presentation, that the final risk adjustment result just released by CMS, and the company also mentioned that in the presentation that the estimates may be updated based on that. The next item is the trend. So 7.7% annual pricing trend, equivalent to 1.86% quarterly trend. And the filing also includes 17% administrative cost, which includes taxes, fees, expenses, profit margin. And as a result, the medical loss ratio projected it to be 85.1% based on the federal calculation. As mentioned earlier, that there is a modified COVID impact of 4.2% is included instead of the 6.0%. After the modification, the required annual rate change is 3.5% annually. We consider the above assumptions reasonable and are supported and agree on the methodology and calculation. The preliminary decision is to prove the 3.5% annual rate change as modified, but will also consider any new risk adjustment and DDP lab program change just presented by the company in the final decision. That's all from me. I will hand it back to Ethan.
Thank you. United, do you have any additional information or comments you'd like to make at this time?
No more comments. Thank you, Ethan.
Thank you. We will now take any public testimony. Please unmute and introduce yourself. Sounds like no one signed up to testify, so let me remind anyone listening, today, July 7th, is the last day for public comments that can be submitted through our website, www.oregonhealthrates.org. Next, we will hear from United of Oregon. We will pause briefly. All right. United of Oregon, please begin by introducing yourself and explaining your rate request.
All right. Let me see if I can share my screen one more time. Steve, could you grant me access one more time, please?
You should still have it if you hit the screen share.
Screen share, let me see. Okay.
There you go. Perfect.
All right. All right, wonderful. Thank you, Ethan, and thank you, Division, for a careful review of our rate filings. My name is Shamsher Plaha, and I'm the Pricing Director for UHC. With this, we will discuss our product offerings for small group market effective 1/1/22. And we'll also discuss our proposed rate changes effective 1/1/22. In terms of the product offering on this license, which is UHC of Oregon or UnitedHealthcare of Oregon, we are offering two plans, and these are two standard plans, one standard bronze and one standard silver. These plans are continuing from 2021, and there are no other changes to the portfolio since 2021. That means no plans were discontinued or added. And these plans are offered on our full network called Choice, and which is same as 2021. So no network changes on this license. This license does not have any members, so the premium rates are based on our UHIC license, and based on that, we are proposing an annual rate change of 2.5% for 2022 over 2021, and the range of the rate change is negative 0.9% to 3.6%. In addition to the new rates effective 1/1/22, we will be increasing our rates starting 4/1/2022 with a quarterly trend of 1.9% or 1.86%, which accounts to 7.7% annual premium trend. As I mentioned earlier, we currently do not have any members on this license. And the plans that we will be offering are the two standard plans. The following rating factors were revised since our last filing submission, that was Q1 2021, and those factors are base rate, quarterly pricing trend that is changing from 1.94 to 1.87%. So on an annual basis, it's 8% to 7.7%. Area factors and then plan relativities are also changing since our last filing. The next slide, we'll discuss the changes that we are requesting since the filing was submitted. The first change is the Covert Adjustment factor. So that is changing from 1.06 to 1.042, which is consistent with what we have for our other license. And then the other change that we will be requesting is the CMS risk adjustment. So we got the report at the end of last month, and we're still calculating the impact. And if needed, we will request to further adjust our premium rates. And that concludes the summary of the proposed rate changes for UHC of Oregon. And Ethan, I will hand it back to you.
Thank you. Division staff will now lead a discussion about the division's review of the filing and preliminary decision.
Thank you, Ethan. Good morning, everyone. My name is Ying Liu, and I'm the actuary of the division and the primary review of this filing.
My name is Michael Sink, Senior Life and Health Actuary for the division and secondary reviewer for the filing.
Hey, my name is Tasha Sizemore, and I'm the Life and Health Program Manager for the division.
Okay, back to the review. So the company requested 4.3% annual rate change in the original first quarter 2022 filing. And due to the company's credibility weighting change, the company modified the COVID utilization rebound from 6.0% to 4.2%. And the modified annual rate change is 2.5% as a result. And this modification from after the modification, the 4.2% utilization rebound is actually in the middle pack of we see cost of filings. So we are fine with this change. And this is a result of a 1.7% rate decrease from the original filed rate change. The division had discussions and considered that since the company's rates is at the high end and the decrease is very unlikely to disrupt the market, will only benefit the consumers instead. With that, the division's preliminary decision is proved as modified. Like mentioned in the presentation, the company didn't have any membership in 2020, and the rates was developed based on UnitedHealth Insurance Company's small group experience and the projections. The proposed rate change also followed the UnitedHealth Insurance Company's small group rates. Since the company has zero experience, the division agreed that way the company develops the rates, the division preliminary decision is to approve the 2.5% rate change as modified. In the presentation, the company mentioned that it's still in the process of reevaluate the risk adjustment final results released by CMS the end of last month. So if later the company discover any deviation from the preliminary results, please communicate with the division and we can incorporate in the final decision. That's all from me. Thank you. And I hand back to Ethan.
Thank you. United, do you have any more information or comments you'd like to make at this time?
No further comments, Ethan. Thank you.
Thank you. We will now take any public testimony. Please unmute and introduce yourself. All right, no one has signed up to testify, so let me remind anyone listening that today, July 7th, is the last day for public comments. Comments can be submitted through our website, www.oregonhealthrates.org. Next, we will hear from Cigna. We will pause briefly.
And Sarah, are you the next one up? And will you be presenting?
Yes, I am.
Okay, let me go and do this really quick. You are now presenter. Thank you very much.
Okay.
All right. Cigna, please begin by introducing yourselves and explaining your rate request.
All right, I am going to pull up this application. All right, thank you. Hi, everyone. My name is Sarah Souza, and I am the Finance and Pricing Director for Cigna's small group line of business. Thank you for giving us the opportunity today to talk about our new entry into Oregon's small group market. Joining me on the call today is Ryan Coker, the president of our Pacific Northwest markets, and several other colleagues as well. While we have over 30 years of history working with groups in Oregon, we are entering the Oregon small group market for 2022. Therefore, we don't have the same types of year-over-year changes that you've heard from other carriers today, and instead, we will take this opportunity to introduce ourselves and our offering. So for 2022, together with our partner Oscar, Cigna is introducing innovative healthcare solutions to meet the needs of the Oregon marketplace. The Cigna plus Oscar product provides small businesses with access to dynamic member engagement care teams and tech-enabled tools. And at the same time, it promotes choice, quality of care, and affordability. Some highlights of our portfolio is that we have a core 19 plans spreading across all metal levels, including 3 HSA plans. Each plan is offered on both our high-quality networks, Cigna's Local Plus and Cigna's Open Access Plus, which has networks of hospitals and physicians and broad behavioral health access as well. Additionally, our plans include $0 telemedicine with providers, prescription drug convenience and savings, and availability to small businesses across the entire state. And we are excited to be entering the Oregon marketplace with this portfolio. From a rate development perspective, we stand behind our submitted rates and request approval without adjustments as they were developed using actuarially sound methods. They are reasonable and not excessive nor inadequate, and incorporate reasonable administrative expenses. We worked with Milliman to submit our rate filing, but we relied upon Cigna's experience to form the basis of our manual rates for both medical and pharmacy drug costs. Milliman calibrated their pricing tools to reflect Cigna's Oregon cost expectations using the same data that underpins Cigna's internal rating models used for other fully insured lines of business in Oregon. We ensured that the provider network relativities between Local Plus and Open Access Plus plans reflect the same differences we observe in Cigna's other insured businesses, since we are leveraging the same networks for our Cigna plus Oscar product where we do have experience. And finally, we adjusted those rates by plan to reflect the expected actuarial value and cost sharing differences. The result is a claim cost specific to Cigna's contractual reimbursements, provider networks, and benefit designs. Our final rates for our PPO designs, which all of our plans are appropriate and adequate for the expected costs that we anticipate seeing for these plans. We have lean out-of-network provider reimbursements for voluntary out-of-network services. In fact, we reimbursed providers at 110% of Medicare, which is a rate generally lower than our in-network contracted reimbursement levels. And this actually results in lower costs per service when a customer chooses to go to an out-of-network provider, which isn't usually the case for some other carriers that might offer PPO plans, and something that helps to drive an affordable price point for the plan offering that we have. We also have lean benefit designs for out-of-network benefits where customers pay substantially more for voluntary out-of-network services. And between those two components of our PPO plan designs and reimbursement schedules, we are able to bring forward affordable plans priced at a level that might be more similar to EPOs in the market. With that, we thank you for your time and appreciate your consideration, and that is the end of our presentation.
Thank you. Division staff will now lead a discussion about the division's review of the filing and preliminary decision.
Hello, my name is Michael Sink, Senior Life and Health Actuary for the division and primary reviewer of this filing.
Hi, my name is Tim Hinkle. I'm the secondary reviewer of this filing.
Hi, my name is Tasha Sizemore, and I'm the Life and Health Program Manager for the division.
Okay, let's get started. First, I want to thank Cigna for their response to our preliminary decision, which was not stated in that introductory presentation, so I'll go ahead and state that now. The division has put out a preliminary decision for the company to raise and approve rates that are 7% higher than what they're currently at now. This includes 2 adjustments that the company has already made, and we are prepared to approve. The first one being an adjustment for the age factors, which were based on the national age factors, not the Oregon-specific age factors. That correction is appreciated and necessary for the state of Oregon. The second change was for an insulin adjustment that predominantly affected the bronze plans. The insulin went to a copay structure instead of hitting a deductible, so a lot of the leaner plans had to make adjustments. And so we've taken a look at those adjustments. We're okay with everything that we've seen on that end. So we're talking about the 7% adjustment. I'm going to walk through how the division got to there. We will go through again because the carrier would like us to reconsider and has given us information on their PPO network. We will take that back with us. I don't have any questions with what you've presented other than I may ask you to put that particular slide in the SERF filing so that the public will have access to that on paper as well as this hearing. So let me go through the basic process for reviewing a filing, and then I will go into the specifics for Cigna. There are 3 main categories that we look at when we review a filing. We look at the data to make sure that it is appropriate for the filing, that the data is the right time period and is properly adjusted to the current market, what they're filing. The second thing we look at is the assumptions that they use to get from the base period, which in this case is 2020, to the filing period, which is 2022. That includes things like trend, adjustments for COVID, market, benefits, networks. Then the last thing we do is we check the calculations to get from point A to point B. Now, the latter one, the calculations, a lot of these calculations are embedded in the Milliman Health Cost Guidelines that the company mentioned, but this is a national model that has been used for years and is well known by the actuarial community, well respected. We have no reason to believe that the company has applied this model incorrectly. So we're going to say that we had no issues with the Milliman calculations, even though a lot of those are proprietary and have not been presented. Cigna has filed a new product. So a lot of the discussion that we have with other filings is that where were they at in 2020, and have they made correct adjustments to get to 2022? Well, Cigna was not here in 2020, and they're pricing for brand new business in 2022. So there's no rate increase. There's no historical experience. A lot of these things fall off, but we have the equivalent calculation with this Milliman Health Cost Guidelines. And part of that information is that Cigna is aligning that model with their Oregon experience. A lot of that has to do with the trends that they have selected. They've picked a trend that is 6.3% for 2020 to 2021, 5.7% from 2021 to 2022. They've been added a 1% adjustment for the COVID impact in 2022, which is high but not unreasonable. Our other carriers have not included an additional cost for COVID. They have a rebound. So we looked at all of the assumptions. We looked at the starting point. We considered the model that they used and the outputs, and we did not find any actuarially unsound methodology. And so the company is correct that this filing appears to be clean and reasonable. We then took a look, as we do for our new businesses, at where the company's rates are. And this is when we noticed that the company appears to be pricing at a level that is more aligned with the EPO, the exclusive provider organizations that are present in the marketplace. And Cigna, as in their filing, announced that they were selling PPO products, which is a preferred provider organization, which has the out-of-network benefits that are not present in an EPO product. So we took a look at the difference between the EPO and the PPO pricing within our within our state, within the products that the companies are pricing, and we noticed a differential of 10%. And our concern was that if the company is offering an EPO price for a PPO product, that could cause disruption in the marketplace. And Cigna has responded to that already. We will take a look at that again. But our concern is that if the company is pricing 10% too low, that is a pricing correction that will happen 2 years down the line when Cigna has experience as their base point for their 2024 pricing. And that would be a normal rate increase in addition to the 10% mispricing and be large rate increases going forward. So our preliminary decision was to put in the 10% differential between the EPO and PPO. It looked like the company was pricing for EPO. We have the reasons now why they did so, and brought it up to the PPO level. We also allowed them, since the other side of this coin is we increased their rates 10%. Now, instead of targeting a 3% margin, the company, according to their pricing, is now getting a 13% margin, which we agree is unreasonably high. So we permitted a 3% allowance for what the company has for margin. So we were doing 10% minus 3%, a 7% adjustment to the filing. And that is the justification for our decision regarding this filing. We will take a look again, given Cigna's response to that. We will make a final decision, and we will, if we have any additional questions, we will ask them through SURF. So that ends my presentation. Does the company want to respond any to that or have any additional comments?
Thank you for the explanation. Just to reiterate, as mentioned in the presentation, we stand behind our rates as filed based on the grounding in Cigna's Oregon experience and the lean aspects of our PPO plans that enable the affordable prices filed. And we appreciate your consideration in reviewing again.
And we will put it back under the magnifying glass and take a look again. All right, Ethan, I think we're back to you.
Great, thank you. We will now take any public testimony. Please unmute and introduce yourself. All right, sounds like no one signed up to testify, so let me remind anyone listening that today, July 7th, is the last day for public comments. They can be submitted through our website, www.oregonhealthrates.org. Thank you, and that concludes today's hearing.